Hi, Miss Kathy here. Welcome to the Infant and Toddler Daily Routine Sign Language Series. This video will focus on diaper changing. It will talk about all of the words that will deal with changing diapers. So stick with us. Changing table. With both hands, you're going to make an X hand shape. One hand will be at the bottom, the other hand will be at the top. And then you're going to flip it. That's the sign for change. Change. And then table, with both arms, you're going to have laying flat down, one on top, and then you will tap 2 times. Table. Changing table. Changing table. Diaper bag. With both hands, you're going to make a modified 3-hand shape that's going to pretend like you're clipping, and you're going to put it to your waistband, and then you will sign diaper at your waistband. Diaper. And then the sign for bag, with your non-dominant hand, you're going to have a fist facing down, and your dominant hand is going to have a flat B hand shape, and then you would go from the front of the fist to your wrist. Bag. Diaper bag. Diaper bag. Diapers. Do you remember the sign? You're going to make a modified 3-hand shape, and then you bring it to your waistband, and then you're going to clip. Diaper. Diaper. Wet wipes. With your dominant hand, you're going to make a W hand shape. You'll bring it to your chin. That's the sign for water. Water. And then, with both hands, you're going to go into a flat O hand shape. And you're going to touch your fingers a couple of times. That's the sign for wet. 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 And then wipe, with your non-dominant hand, you're going to make your fist facing up. And then your dominant hand, you're going to have underneath. And then like you're wiping. Wipe. Wet wipe. Wet wipe. Diaper, cream, or ointment. Remember that sign for diaper? That's correct. Diaper. Now the sign for cream, it's a type of medicine that you would use on a rash. So we're going to sign medicine and then cream. So with your non-dominant hand, you're going to have it facing up. Your dominant hand, your middle finger, will touch the palm of your non-dominant hand, and you will go back and forth. That's medicine. Medicine. And then you're going to, like you're rubbing it on, the ointment. Cream. So we would say diaper, cream. Diaper, cream. Change or changing. We talked about that earlier. You have 2 X hand shapes, one on the bottom, one on the top, and then you're going to flip it over. Change. Changing. Diapers on. You're going to have your diaper sign, diaper, on. Diaper, on. Diapers off. Diaper, off. Diaper, off. Clean. With your non-dominant hand, you're going to have it facing up. with your dominant hand, you're going to have it facing down, and then from the wrist or the palm, and you're going to, like you're wiping, clean. And you'll do that one. Clean, clean. Dirty. We have a dirty diaper. With our dominant hand, you can have a 5-hand shape. You will have it facing down. You put it under your chin, and then you wiggle your fingers. Dirty. And you kind of have a look on your face. Dirty. Dirty. This diaper is wet. We're going to make a W hand shape and then sign soft. Wet. 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 This diaper is dry. With your dominant hand, you're going to put it to your chin and then move it across. Dry. Dry. Diapers, dry. Wet. Wipe. To wipe a baby's bottom. With your non-dominant hand, you're going to have a fist that's going to be facing up. And then your dominant hand, you're going to have a B hand shape that's going to be underneath. And then you wipe. Wipe. To wipe. We have stool, BM, which would be bowel movement, or poop. So with your non-dominant hand, you're going to make a fist. With your dominant hand, you're going to make a 10 hand shape. You're going to put it inside your fist and then come out. Poop. Poop. Stool. BM. Urination. Urinate. Pee. You're going to make a V hand shape. You're going to put your thumb on the middle finger to make the letter P. And then you're going to bring it to your nose and brush off. P. Urinate. Urination. P. Rash. There's a couple of different ways that you can sign it. One, and there's a combination of signs that you would put together. So the first one is you can sign red, where you're going to have your index finger at your mouth and you bring it down. Red. Red. And then you would kind of have it like it's spreading. So you're going to have a 5-hand shape and then it's spreading. And then you would itch it. So rash. Rash. Another way that you can do it is to have where the rash is. So again, you would sign red. And then where the rash is, where you going in a circular motion. Rash. Rash. Stinky or smelly. It would be the act of holding your nose. So with your dominant hand, you're going to take your finger and your index finger and your thumb, and you'll hold your nose closed. Stinky. Smelly. And you're going to have the face that shows stinky. Woo, stinky. All done or finished. With your 5-hand shape, you're going to have it kind of facing you, and then you're going to flick. Finish. Finish. We're all done. Finish.